I really encourage educators to take a look at these research studies about the movement differences in autism. Ann Donnellan and Martha Leary have done some really great work. Michelle Hardy in the field of music therapy, Michelle Hardy and Blythe Lagasse are folks to watch and to read their work, because it can really change the way that we approach what we're seeing with our eyes. If a student is cognitively intact, which oftentimes they are, even if they don't have reliable communication, they so appreciate being given access to learning, being given access to the same opportunities that other students get. And I think the music classroom is one of the best places for that to happen, because music is universal. Music can be experienced in some really social and wonderful ways. And the other thing is that we know from research that music is organizing, and music is structuring for not only movement but for communication, for socialization, all of those things. So if we can look at even these kids who have disorganized bodies, maybe have lots of dysregulation issues, if we can use the strength and the tools that we have in the music classroom to help with that regulation, to involve them, to encourage them. I'll speak specifically to movement differences again, just because I think people, when they hear about that, they're not really sure what that means. And so the three things that we're finding in research to watch for: number one, difficulty with initiation. If you have a student who seems to kind of get stuck and can't move their hand forward to play a rhythm, or can't move their body without a lot of prompting, they may have an initiation issue. Also, inhibition seems to be sometimes a difficult thing. So if they can't stop themselves, if they can't stop their bodies, if they start flapping or they start jumping or they start running around the room and they just look like they're completely out of control, it's probably dysregulation, but it's probably also an inhibition issue. So sometimes just finding, okay, let's go over here and stand next to the Velcro, like she said, looking for some way to kind of help them keep their body where it needs to be, or keep their focus on what it needs to be on, as opposed to perseverating on something else. And then sustaining. If you have a student who looks like, okay, they can initiate and they get started, but then they just so quickly fall off, they stop singing, they stop playing, they stop, that they just may need someone to sit next to them that can just redirect, okay, here we go, or keep going, or go, just to give them some little cues to help them be able to sustain and maintain their engagement. So if you have students that are presenting with any of those three issues, it may be, like I said, it may be a movement issue more than a cognitive or comprehension issue. So again, that's even more reason to kind of forget what your eyes are seeing and really think about what possibly could be going on, and think about different ways to provide support for them in the classroom that would meet those needs, as opposed to approaching it from a behavioral standpoint where they get a consequence because they couldn't stop their body, or a consequence because they are stuck, instead of just being what might be perceived as being defiant.